Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise that we're going to teach you using a modified version of the Cliffhanger to help reduce hip hiking tendency and helping to decrease your chances of lower back injury. Hope you enjoy. So hip hiking is a very common postural disorder, mechanical error that many trainers have, and they don't realize it until they develop lower back pain. Hip hiking is where one hip has a tendency to elevate up more than another due to overactive abdominal and back muscles on that side and a weakness in the hip abductor muscles that help drive that hip down. You can identify this with your training if you're squatting and lunging. If you notice one hip comes up slightly, leg pressing, you're going to have a tendency to raise one hip up. You can also identify that by in a standing position or walking. If you notice one leg likes to turn out more, that is called external rotation of the hip, and it has a mechanical error of bringing that hip up or hip hiking. This causes a compression on the lower back, creating disc problems, joint problems, sacroiliac, and even hip problems on that side. So to correct hip hiking, we have a lot of exercises, but this one we're going to use the classic Cliffhanger exercise. So we're going to take the side that hip hikes, and we're going to position that side down. So for instance, on this bench, I'm going to lie with my legs hanging off the edge of the bench. And in a classic Cliffhanger, where we're oscillating the feet up and down to develop the lateral abdominals, such as the obliques, one side of the rectus, the back muscles, including the lat, the erectus spinae, the quadratus lumborum, as opposed to keeping the feet level with our body in the bench, we're going to elevate them up slightly. And that's going to create an opening on the bottom side where I have a tendency to hip hike, and it's going to recruit the opposite muscles that are usually weak on this side. It's going to make the QL, the erectus spinae, the abs work a lot more on this side that doesn't hip hike in a tendency to bring the pelvis back into balance. And then we can oscillate from there. So it doesn't matter how much higher you go, whatever feels comfortable. Start with maybe 1/4 of an inch higher than neutral, and as your training continues, you can then elevate that up to higher levels. And that oscillation back and forth, as long as you're keeping your alignment, ear, shoulder, hip, knee, and ankle all in one line, and any rotational disturbances, if you also have a tendency to rotate to one side, hip or pelvis, keep that in postural check. We're going to perform that Cliffhanger. At the end of that, you can use it as a warm-up for your training. You're going to notice that you're going to be a lot less likely to raise that hip up because you've just recruited the opposite muscles. They've created an inhibitory effect on the muscles that usually hip hike, and your training will be a lot cleaner, better form, less chance of an injury. I hope this little exercise, the Cliffhanger, helps with your hip hiking problems and enhances your training.